go live is not the finish line. Go live is when you actually get to do the testing. And so that's where you create a bottleneck, is that you are like, we're good. We've gone through 1 week of go live. Everything's working. We don't need to make any more changes. But that's actually where the magic happens. You've made all these workflow decisions and you think that they're going to work, but they don't always work. And the magic is seeing what you can do to improve what you thought was going to work and create a true workflow that's going to work for the patients and for the clinicians.
You're here with us on Founder Mode,
where we sit down with people building systems that solve real problems in real industries.
Today's episode is about healthcare, but not the innovation headlines. We're talking about the blockers, the bottlenecks, and the friction points that slow everything down.
From broken workflows to regulatory walls, our guest today has seen it all and now helps healthcare businesses cut through it.
Jason, every healthcare operator we've talked to has one thing in common. They know what needs fixing, but the systems around them make it almost impossible to fix anything.
Yeah, that's why this conversation matters so much. Rebecca is building a consulting firm that doesn't just talk about change, she helps deliver it. Before we get into the conversation though, Kevin, let me share my own journey into the intersection of healthcare and tech. I actually co-founded a startup called Heal. This is over a decade ago now. And it helped me realize just how hard it is to build in healthcare and to leverage the latest technology, because there's so many things, so many institutions, lobbyists, regulations, compliance hurdles that make it really hard, right, to build. And so from my perspective, like anytime that we can bring cutting edge tech to healthcare, it's a major win, because it goes back to like the Peter Thiel order of magnitude, 0 to 1. Like anything that involves new technology in healthcare is going to be hugely a 10x improvement on the way things are done. It's funny. I think Rebecca will probably talk about this, but healthcare kind of started with the house call, right? And so this company, this app I started, Heal, was all about doctor house calls. And the idea that a doctor coming to your house is actually 10x better than going to a waiting room and sitting in a clinic. I got to see firsthand that like when technology enables clinicians to spend more time with patients, it's a good thing. And for me, it's like it was really hard to make that business work economically. But man, if that could be the healthcare experience, and if Rebecca's enabling these healthcare companies to have better experiences for their patients, that that's the ultimate goal. And I think we often get so distracted by the regulatory garbage that it's really hard to do stuff, right?
Yeah.
I know that you do a lot of work in healthcare and AI right now. Maybe you could talk to us a little bit about what you're seeing and how founders can operate in the new paradigm.
Yeah, when you said 0 to 1, I was thinking, for more than 20 years, building stuff kind of in SaaS and consumer and enterprise, like it was hard to build there. But when you started building it, you could just kind of deploy it and go. You could start small. There wasn't a lot of friction to get going. And I think what we're seeing in healthcare is that 0 to 1, and especially like the 0 to 0.1, like just to start, has a pretty high barrier to entry. But the cool thing about AI is it's simplifying a lot of that, right? A lot of the complexity and the differences between how different practices operate, but also how different workflows are changing. AI is able to sort of like learn that on the fly. And quite frankly, just reason over stuff that we didn't have the tools to do. And so one of our companies is doing a lot with healthcare AI and specifically around voice. So taking patient voice and using that as a wedge to really learn everything about the practice, right? So if you pick up every phone call and first ring, now instantly the patient can have someone to talk to, answer their easy questions, make a reschedule, ask for medication refill,
weekends, holidays,
have that routed at any time of day directly to your doctor inside the EHR, which I think Rebecca's going to talk a bunch about, without sort of having a human needing to be there. And so then it frees these humans up. And so I think the big opportunity that we see is that AI can really start to collapse that ratio and get it down where like we just don't have as many humans having to manage the paperwork, and then those humans can go back to spending time with patients, right? I think it's nothing that frustrates providers and doctors more than like having to like spend 2 minutes or 5 minutes with your patient and then go spend 15 minutes fighting with a system or putting data into a system, because that's what's required to move the, sort of piece down the line.
Yeah, I think that's right. And when I started Heal, the sell to the doctors that we signed up was like, we'll do all the admin. You just go see patients.
One person I was talking with was great. It was like, they're like, everybody in healthcare should be working to the top of their license. Like the doctor should only be doing doctor work. Like the nurses should only be doing nurse work. They shouldn't be doing a lot of administrative overhead. And I think that's where AI really has this sort of like ability to really crack that open and solve a bunch of this stuff kind of with really lightweight reasoning to sort of like rationalize over all these little things that are happening. Yeah, it's been pretty cool. And we're, like I said, seeing over half the calls are just completely handled by AI. And it's like, well, we just don't, a human didn't have to touch it. And now those humans have freed up so that when you do get transferred to a human, you're not waiting an hour or 2 hours on hold. You're able to get to a human within a minute or two. And then handle whatever complex issue you had or sort of question that you had, which is pretty cool. Rebecca started in urgent healthcare operations and moved into EHR implementation, billing systems training. Today, she runs a firm focused on helping healthcare teams move faster and smarter.
Yeah, she brings a unique lens, part clinician, part operator, part founder, and her story is one every healthcare builder should hear. Let's get into it.
Rebecca, welcome to Founder Mode. You've worked inside a bunch of complex organizations like all over healthcare and, sort of from the EHR side now to revenue cycles. And now you're really helping organizations kind of fix what's broken. Let's get into what's slowing things down and how you're helping speed them up.
Yeah. Well, just to call out what I'm working on, we specialize in working with Athenahealth clients, which is a specific EHR. A lot of the work that we do is helping them optimize their workflows within the EHR. And because Athenahealth is very API integration friendly, we're seeing a lot of instances where we're bringing in other vendors that are providing additional solutions that Athena or the client can't provide. And a lot of the things that we see that are slowing down is change management, training, and things like that with our clients. And our goal is to help them fully utilize the system and have high patient and clinician satisfaction.
Welcome to the show, Rebecca. And, it's exciting to kind of get a peek inside of the machine, if you will, of how all these very complicated healthcare organizations operate and how they leverage the kind of state of the art in technology. So cool to see it from your vantage point. You actually started, I think, in urgent care operations and rose through the ranks. What are the bottlenecks that kind of made you realize it was time to start your own thing?
Well, just as a brief answer, again, it goes back to change management. We find a lot of times that organizations, even the company that I worked for, had a lot of visions, but they tended to stop at go live with making a change and didn't really put forth the time for the optimization phase and also providing their staff the ability to learn the system. So that's kind of why I moved I was a director of operations there and went into consulting, and then of course have started my own thing, and that's what we focus on.
When you look back at those early days, what was like that problem that you saw that just hadn't been solved that sort of like, sort of was that sort of spark to kind of shift?
Well, let's take it back. I've always worked in healthcare. So I started when I was 18 at the front desk. And I always came back to like, no one had the time to fully utilize the system. Providing space for you to fully optimize the system and taking the time to do that. And that includes like leadership down to the front desk person. Like there's not enough space for time. They're not leaving space to optimize. And that's kind of why I've moved into this space. No pun intended.
Let's talk EHRs and implementation. It's a complicated space. Speaking of spaces, and you've led dozens of go lives. What's the number one reason that EHR rollouts fail to deliver on their promise?
Yeah, as far as the EHR, they want to be turnkey. Like everyone can use the same solution. Like it's going to work for you, but there are nuances to every organization, like how they prioritize what's important to them as an organization, whether it be the patient experience, clinical experience. We get clients that want to have the vanilla standard setup and others that are providing value-based care and they want to have the system work for them versus them working for the system. So as an EHR, they're trying to make this turnkey product, but it's never going to be that way. Like healthcare isn't necessarily turnkey.
Yeah, it makes sense. And then When you think of the bottlenecks kind of reaching that point, either right before go live or sort of just after it, what are the things that you typically see that sort of kill that momentum?
Well, one, it's the theory that people think that go live is the finish line. Like, go live is not the finish line. Go live is when you actually get to do the testing. And so that's where you create a bottleneck, is that you are like, oh, we're good. We've gone through 1 week of go live. Everything's working. We don't need to make any more changes. But that's actually where the magic happens, is through that go live. You've made all these workflow decisions and you think that they're going to work, but they don't always work. And the magic is seeing what you can do to improve what you thought was going to work and create a true workflow that's going to work for the patients and for the clinicians, and also bring in a higher revenue model for them. So that's kind of where I see the bottleneck.
There's a lot of lessons in what you just said that apply broadly to tech and founders, which is our audience for this show, right? Like the idea that like the launch is basically day zero, right? And it's
It is.
you know, T minus 90, 60, 30, here we go. We launched, we went live, and it's like, oh, great. And we just walk away. No, we have to keep iterating and working to get the thing to actually do what it's supposed to do, right? So I think that's an important point and well made. So you've kind of come up with this thing called the silver bullet strategy. How does that approach shift the success rate of these implementations?
Yeah. So I just spoke about how EHRs are turnkey, which can happen. Our silver bullet is that we have a project plan that's turnkey, but on the back end, something that's not client facing is that we're always evolving this project plans. As I mentioned, we work with clients that use Athenahealth. We are always making sure that our project plan is the most up to date, meeting payer requirements, CMS, anything else that's changing in the healthcare space, so that it appears to the client that it's turnkey. And that's what makes it successful. The other thing about this is that it doesn't stop at go live. Again, that's day zero. Our project plan continues throughout the optimization phase, change management phase. And we're seeing a lot of our clients that use this tool have a high success rate for go live and client and patient satisfaction.
That's cool. One of the things we've seen is one of our companies is in healthcare, and is like clinicians sort of like skeptical of another system update or skeptical of new technology. Like, how does that sort of impact the work that you guys do? And how do you sort of deal with kind of like calming the nerves, or just sort of like shepherding people through those changes? Because, you know, technology sometimes moves at a pace that may, you know, outrun like their internal processes or the things they're used to.
Yeah. One thing is, every engagement that we have, there is at least one clinician that's skeptical. And it comes from, you know, having been burned in other experiences, like they've worked for a previous organization. Our approach is that we start discussing that during the like initial implementation phase. Who are the clinicians that are going to have buy-in? Can we have a champion that can help us understand like what are the things that the clinicians are going to need, or they're going to create risk in a successful go live? And then, as I've mentioned about space, like creating the space for the clinicians to be heard, to have time to do the training and actually use the system even before go live. So Athenahealth does have like a training space. Getting them to like touch and feel the system first is really helpful. It a lot of times eases their nerves about the system. Not every clinician's going to like it. That's the other thing, is there's always going to be someone that doesn't enjoy the new workflows. But getting to understand that, is it just because they're always like that with everything, or is there an actual problem? So listening, giving space for training are two of the things that we can help eliminate some of that risk.
You can't please everybody all the time, right?
No, you can't.
So you've worked on credentialing, billing, and regulatory transitions. What slows down innovation in the revenue cycle? And maybe there's some things here with AI that can change that.
Yeah, a lot of bottlenecks in the revenue cycle credentialing space is that there's so many nuances in the payer world. Every payer wants something different, and that can change. Like if you look at Blue Cross Blue Shield, even their workflows change from state to state or even county. And you add even further like government packages, they've got their own workflows. Understanding all of that, you know, you've got your individuals that have worked 20 plus years. It takes a lot of time and space to continue to understand and know what all of those nuances are to make it successful. And then there's just all this administrative work that's embedded in that. And that's where AI can assist. So you've got, at least with Athena, they've got rules engines where they're training their system constantly. They get a denial, they're understanding like, is this a one-off or is this a new payer trend? And then, speaking outside of Athena and integrations, because Athena heavily utilizes API integrations, they want this unique ecosystem. AI is able to take over some of that burden, credentialing and enrollment, authorizations, referrals, getting that information, not having to use an individual, which, by the way, those people don't even want to do that stuff. It's time consuming, and the success rate sometimes isn't high for an organization. So using AI or robots to perform some of those duties can eliminate that administrative work. Also talking about scheduling, things like that, that's also something that AI can take over, which assists with then choosing the right insurance and then applying that to authorizations, referrals, and back-end denial.
Yeah, it's interesting because you kind of think about like the revenue side as kind of the back end of healthcare, and you're sort of saying AI can touch everything, and you sort of see it, the things that it does up front to make better decisions around maybe how the schedule was set or how the actual appointment was made will actually impact, a higher success rate at the end because, they're getting the right service and it's coded the right way. Where are you seeing that sort of help the most, right? And are there places where it's more popular than not and, actually helping healthcare in a broader way?
Well, you two bring up a good point. Revenue cycle doesn't happen once a claim's created. It's as soon as the patient is registered. One, selecting the correct insurance package. Human error is pretty high. And that's also not the front desk's fault. Patient may come and be like, I got TRICARE, like, I don't know what kind, and I don't know my ID. So being able to pull information even from like, if AI can pull information from the license, because a lot of times you can use the license. Checking eligibility is something as well, like someone may be eligible, but they might have a PPO HMO plan. Using AI to make those selections versus having someone who's got 15 people in front of them, they're just going to select the best thing, whereas AI is going to make a correct selection. That's going to eliminate, front end denials, back end denials. I do think that if you don't have a amazing staff in the front desk, which by the way is that role has the highest turnover in healthcare. I think AI has a great space in the front desk area. So scheduling, registration, insurance selection, we go back to authorizations and referrals. By making the correct protocols, processes on the front end, you're going to increase revenue on the back end.
What's really holding this kind of utilization of AI and bringing AI in back from making an impact in your world? Is it more policy, process, culture? What do you think is holding it back?
A lot of it is culture. So they have hired individuals, some of them they've built rapport with. Productivity's low and they're trying to figure out how do we like make these individuals more productive. And I don't think it's necessarily that you need to eliminate them. There's still going to be jobs that the organization can keep staff on if they fit culturally. But I think the reason why they're not making that decision is they're like, I don't know what Betty's going to do if she doesn't do medical records. Well, we can elevate her to do other things besides the like administrivia tasks that can be
we got to
handled by
upskill
AI.
Betty. She doesn't have to lose her job, but we got to help her learn new skills. It can't just be medical coding. The computer can do more and more.
Absolutely. So even with a situation where we've got AI, there's going to be a management piece to it. So we're going to still need to do audits. We're going to still need to train the AI to keep improving, and then also monitoring. So if Betty's working on medical records, she still may have to monitor the inbox where AI is not taking over, allowing her to have more strategic outcomes with the role that she's got.
Yeah, I think before the show, you and I were talking earlier and about like how your team could, sort of play that role where you're sort of the bridge between like AI is implemented. And as you start to see these early tech wins, like, are there success stories that you can share that you've seen where you've like became that bridge where you're like helping the Bettys of the world sort of like monitor what's going on and then give the feedback to either the technology or AI to make it improve?
Yeah, so with our clients, we either helping them onboard new systems or they're optimizing their existing space in Athena and bringing on integrations. Our work doesn't end with the EHR. So if there are opportunities where we've got staffing that isn't performing, we're going to bring in a third party. And some of that can be AI. Where we've seen success stories is actually around the authorization and referral space. So moving Betty out of authorizations, referrals, and getting her to work on back-end denials, where we haven't yet put AI. And then what we're doing is we're creating a process of monitoring that AI, like teaching the system to make updates, and then also looking at productivity and seeing where we can even make improvements from scheduling. Now we've got more time and we're able to get paid. Let's increase scheduling. So we're trying to see, like, how is the AI positively impacting the organization, and where can we make, like, increase revenue? And it could be scheduling, it could be even just moving staff around. And that's part of what Ignite does, is help with staffing and operations.
That's a good transition to my next question, which is, you have actually been recognized for building a female-led firm. How does diversity in your team shape better outcomes for your clients?
Yeah, I started Ignite because I became a mother, and my husband's also in the military, so I wasn't able to travel and I needed to be flexible with my schedule. Ignite is, except for one employee, all females. And what I found is that some moms are wanting to have that flexibility, and I've been able to tap into resources that otherwise wouldn't be available in the healthcare space because they don't have the ability to work full time, or they need to change their schedule last minute. So our employees are deep subject matter experts, and I've been able to tap into that resource of subject matter experts because I allow for a flexible schedule. This also allows my staff to not have that burnout. So they come to every engagement fresh and eager to help versus, working 50 hours a week and having that stress. So our clients don't see that stress, and they have individuals that can dedicate time for them.
What do you wish more founders knew about retaining talent, especially in healthcare? I mean, you talked about the front desk staff being this high turnover role. Mm-hmm. Are there other roles where you see that? And what kind of advice would you have to founders in the space, either those in healthcare or those in sort of accessory, companies around it?
Yeah, for us, we're a services organization. So our product is our people. So for me as a founder, if you're starting an organization and you want to create a brand around services, it's expensive. You need to pay up front. And that allows your staff to see that there's value. So if you're just going to pay the average salary for a certain role, you're not going to be able to tap into certain resources. Like for us, our leadership team, I would never have been able to have them on our team if I didn't provide them with a salary that showed that they were appreciated. For high turnover, like with the front desk, Ignite's opinion is that those should be individuals that are paid higher or have some sort of bonus structure that incentivizes them to do a good job if you're not going to use AI. And then also don't give them too much work. There's only so many hours in a day. If you're trying to shove in 70 hours of work in 40 hours, you're going to have high turnover. So even at Ignite, we constantly have conversations around staffing and workload and taking things off their plate because we need them to do an excellent job. So excellence is key for us.
I like the emphasis on paying humans more for their time and valuing them. I just saw a viral thread on some social platform, and I don't know if this is real or not, but it was somebody checking into a hotel in the middle of nowhere, America, and the check-in front desk was somebody overseas on a video link checking them in.
Wow.
It's very different than what we're talking about here. And like we're talking about healthcare, right? We're in human health care and getting some other human to help you, right? Like it's a part of our humanity and our dignity. So it's nice to have an actual person that's physically present there with you, helping you. Anyway, I just think that's interesting. And it's at this point, it's kind of a contrarian take because a lot of people are like, let's use AI to eliminate as many jobs as possible. And it may not be the right answer all the time, right? And
yeah. I think we go back to the administrative burden, like in healthcare, when we first started in healthcare, you've got the doctor going to someone's house. They're not bringing a bunch of paperwork or an MA who's like scrolling their laptop over to type behind them. And then because of healthcare policies, we've added all this administrative work. I think there will always be a need in healthcare to have helping people, but there is this administrative level that's so heavy and creates burnout. And I think it is important that we start incorporating AI into the system so that we can allow people to feel appreciated, have an appropriate workload, and then they don't have burnout. And again, we go back to patient clinician satisfaction and a lower turnover.
Yeah, I think it's this ability to use AI to take away that sort of monotonous, sort of like boring stuff, and then allow them to do the fun stuff, but also just be able to be human again and react to patients. I think you come into a location and they're constantly on the phone and there's tons of people waiting on hold versus like, hey, that's being sort of handled by AI. Now we can talk to the people that are in the clinic and sort of in front. So pretty impactful. Well, this has been great. Where can people connect with you and learn more about what you're working on?
Yeah, of course. You can connect with me on our website, ignitehs.com. We've got consistent blogs. If you're an Athena client, you can find us on the Success community. We're in user groups. And we'll also be at Thrive, which is Athena's annual conference in Nashville. So we have a booth there. So if you're an Athena client, come stop by.
All right. That's awesome. That's the first one of those we've had on Founder Mode. Let's get to Nashville. I'm coming. This was sharp and this was grounded and really too real, Rebecca, for anyone who's working in healthcare to ignore. So thank you for joining us.
Of course. Thank you for having me.
Dude, that was a fun conversation. It went deep into complicated regulatory category. I mean, Rebecca doesn't just talk systems, she builds around them.
Yeah, and she reminded me that progress in healthcare doesn't always come from big breakthroughs, right? It comes from just showing up and putting in the work even after you go live. What were your top 5?
Yeah, so I think the first was just this optimization after go live is critical, right? Change management, kind of really starts once the system's turned on. And a lot of times that training gets overlooked. AI and these API integrations, especially with Athenahealth, can streamline admin tasks, reduce denials, and really just, quite frankly, help boost revenue and patient satisfaction. Success really depends on customizing these EHR workflows. So like every organization, every provider is different, and you can't rely on this like sort of turnkey setup. And then flexible staffing, competitive pay, to retain talent and build a great team and reduce burnout, you've got to find a way to sort of keep, your people happy and really retain your best. Using AI to remove that kind of monotonous work, right? These clinicians and providers to actually focus on patients and improve the satisfaction of the actual outcomes rather than spending all their time pushing paper.
If you're building in healthcare or working inside it, send this to your team. It might help unstick something.
And if you haven't already, subscribe to Founder Mode, drop a review, and help us keep bringing operators like Rebecca on the show. That's a wrap. Go Live isn't the finish line. It's where the real work starts.